everyone. All right, good evening, everyone. Thank you for taking time out of your night tonight to join our heart health wellness session. As we all know, February is Heart Health Month, and it's such a good reminder just to take care of one of the most important muscles in our body, our heart. But heart health isn't just something we focus on 1 month out of the year. It should be something that we all want to protect and support all year long. So, our goal tonight is simple. We're just going to talk about healthy lifestyle habits and how to be proactive instead of reactive. Now, what I do want to say is that the information here that we're sharing tonight is going to be for educational purposes only. We cannot make medical claims, and nothing that we share is intended to treat, cure, diagnose, or prevent any disease. So we want you to always consult with your healthcare provider regarding your personal medical decisions. But what we can do is we're going to share education tools and options that support overall wellness and help you take ownership of your health. So again, thank you so much for being here. And we are going to go ahead and jump right in. I'm going to turn this over to Miss Carrie Hicks. She is our resident guru here. We like to say that she's been a registered nurse since the 1900s. So, Carrie,
That
take
was
it
a
away.
long time. And we are honored to have Miss Tara. Oops, hold on. There we go. We're honored to have Tara Gunner here. She has joined our team and she is she's been a registered nurse for 33 years now. She's been a nurse practitioner for 16 of those years. And she has her own clinic in Ashburn, North Carolina. So if you're ever looking for someone who is a great medical practitioner, and you're in this area, you need to go see Tara. So I've asked Tara to join us tonight and just kind of share, you deal with heart patients all the time and lifestyle issues. And so I asked her if she would join us tonight on our heart health wellness. So thanks for joining us, Tara.
Thank you all so much. I'm honored to be here and a part of this. And this is something I'm very passionate about. Like Carrie said, I've been a nurse for 33 years and nurse practitioner for 16. I am an old cardiac nurse. My daughter is now a cardiac nurse. We are very passionate about this. I myself experienced a myocardial infarction or heart attack at age 43 due to a dissected artery. And so I have two stents in my heart, and I'm considered a patient with cardiovascular disease since that event. So I am passionate about helping people to live well. Prevention is always best, but I am under the belief that even those that have had an event, have chronic disease, can choose to live well by the choices that they make. And that is exactly what I try to do each day in my practice. For a long time, I have been the primary care provider that treated the disease once it happened. And about 18 months ago, quite frankly, I just became quite burned out in being primary care, being all things to all people. And I started digging in and delving into the preventative medicine world. And so now I'm doing more of that health coaching and helping people to hopefully reverse chronic disease, come off of medications, and those kinds of things with healthy lifestyle habits. So, why heart health matters? I see patients all day long that have hypertension, high cholesterol, type 2 diabetes, and we do now know that type 2 diabetes equals cardiovascular disease. It is a disease of the microvascular and macrovascular health. These diseases, unfortunately, are often silent. And that's why heart health matters, is because if you're not going and being seen regularly, at least once a year for your annual wellness exam, you have no idea what your blood pressure numbers are, what your high cholesterol numbers are, what your A1C is. Those are indicators that are going to help us drive lifestyle treatment choices and help you with things that may be going on that you're not even aware of. So it is so important to make sure that you're doing those things. You need to know what your risks are, so you know what you need to work on. On this screen here, most heart issues are lifestyle driven, and that is so true. And I've seen as little as 10 pounds weight loss radically affect someone's blood pressure positively. So this is one of the things that we talk about in my office. If you'll change your lifestyle, it's often, not always, but it's very often that you can come off of medications. It takes work to do this, and it's, of course, always easier to keep your health than to regain it, just like Dr. Strand has told us. But prevention is powerful. So our daily habits impact our blood pressure, our cholesterol, things like our diet, things like our activity level. The saying now is that sitting is the new smoking. And so those kinds of things do make a difference in our body. But if we have small, consistent changes, it can create huge results for our overall wellness. Prevention is powerful. Don't smoke, don't drink, watch your processed foods, eat whole foods, exercise regularly, and keep your stress level in check. And sleep. Those are the main things that I try to emphasize to my patients. Nutrition, such a huge part of overall health, but especially cardiovascular health. And basically, I just want to say follow the 28-day plan. These are the things that are emphasized on that. Your lean proteins at every single meal. Make protein your leading food that you do. Ordered eating does matter. Those leafy greens, your colorful vegetables. How many times have we heard eat the rainbow? Make your plate colorful. Those types of things help a lot when it comes to preventing cardiovascular disease, hypertension, high cholesterol, type 2 diabetes. Your healthy fats like your olive oil, avocado oil, your nuts, absolutely reducing processed foods. One of the things that I try to do is have patients look at a food label with me and understand how much stuff is being added to our food supply. And if you can't read those ingredients, if you can't pronounce them and you don't know what they probably are not the best for you to be eating. And we talk about that. Hydration is key. And then choosing those low glycemic foods to balance blood sugars, just like is emphasized in the approved food list. Go ahead to the next slide. And managing stress. So one of the things that I also talk to patients about is how much stress, chronic stress, affects our body in regards to inflammation. If you are always functioning in fight or flight, your body is in a chronic state of inflammation. That is going to be inflammation not only like we think about as far as osteoarthritis and pain and that kind of thing, but inflammatory changes of our arteries, which can lead to cardiovascular disease. So, even if you're eating right and exercising right, but you're always in that high stress mode, there's going to be inflammatory changes that are happening, and that can lead to a cardiovascular event. There are things that we say in healthcare and we throw these diagnoses around sometimes, but they're very real. Broken heart syndrome is a very real thing. How many times have you heard I've experienced this in my own life in the last 6 months? My mother-in-law passed away 5 months ago, and we just lost my father-in-law last week. Broken heart syndrome is real. When they lose their spouse, when they lose a loved one, many of them begin to have that chronic stress, and those inflammatory changes do happen. Caregiver stress, another huge factor when you are caring for loved ones, you're caring for parents, you're caring for a sick child. Those things can also raise blood pressure and raise inflammatory changes that are happening in the body. Workplace stress is real. So we have to find those things like is on the screen, practicing our deep breathing, the boxed breathing method. Get outside every day and get some of that natural vitamin D. Protect your peace, whether that is sitting down in the mornings and having your quiet time, meditation throughout the day, getting away from the things in the office or the work environment that kind of, makes us on edge. Get away from that. When you're in the car driving home, get that downtime, turn off the radio, and just have some of that quiet, peace. And sleep. Huge. We now know that lack of sleep or poor sleep quality is leading to all kinds of cardiovascular problems, high blood pressure, sleep apnea, inflammatory changes in the arteries, like we talked about, stroke. I cannot emphasize enough of 7 to 9 hours of sleep at night, uninterrupted sleep in a dark room with a cool environment, solid sleep. So there's so many things that we can do that make small changes, but those small changes lead up to big health habits to help us with our cardiovascular health. One last thing, one of the things that I love about what I'm doing now is when I'm helping patients with weight loss and their health journey. I've seen many patients be able to come off of their blood pressure medicines, come off of their high cholesterol medicine, come off of their diabetes medicines, all because they made those changes. And they are just adding not only years to their life, but quality years to their life. And when we think about our health span and our lifespan, we all have a lifespan. We know when we were born. We don't know our death date. That's our lifespan. But I'm at the point in my life now that I'm thinking not just about my lifespan, but my health span. I want to be independent. I want to be able to enjoy life, even into my 60s, 70s, 80s. And what I teach patients is the choice that I'm making today in my 50s, that's going to affect me when I'm 60, 70, and 80. And whether that choice is good or bad depends on what things are like for me in my 60s, 70s, and 80s. So we've got to protect that heart. We have two sayings in our office, and I'll close with this. One is, it's never too late to start living well. And we want our patients to truly know that. And the last thing is live well and find joy. And those things matter when it comes to our stress and our overall health.
Yeah. And it's all about, we can live a long life, but it's really about the quality of your life. I mean, who wants to be sitting in a nursing home at 100 years old and miserable? Just because you had the quantity, did you have the quality of life that you could possibly have? So we definitely want to, live a lifestyle that is preventative. We also want to help maintain a healthy weight. That excess weight that we carry, that is going to strain your heart. And a lot of times people don't realize that it's not only just the number on the scale, but where the actual weight is carried. So if you have a measuring tape, I keep a measuring tape in my desk here. If you have a measuring tape here, take the time to actually measure the circumference around your waist area. Women, if you notice that your waist area is 35 inches or more, and men, if you are 40 inches or more, that means that you're at higher risk for diabetes, the type 2 diabetes, for heart disease, high blood pressure, there's strokes, cancer, there's so many things that go on. So it's not like you just gained a few pounds. It really and truly does affect your health when you're gaining too much weight right there. And why is that? Well, a big part of it is the visceral fat. And we all have subcutaneous fat, that's the squishy fat. But underneath that, you have the visceral fat. And that visceral fat is that hard fat that goes around your vital organs. That visceral fat, it increases inflammation that a lot of people deal with. It can affect your insulin resistance. It can raise your blood pressure, just like Tara was just talking about, and it stresses the cardiovascular system. So when we focus on losing weight, it's not just about losing weight, but it's about losing fat. And we do use our supplements as tools to help you succeed with your health. So a lot of times we're asking you, like, what is your personal goal? And if you do have a lot of visceral fat, then we have tools to help you. So a lot of us are doing the Slenderized drops. It helps, it's a homeopathic system that we have. And yes, a positive side effect is for you to release weight, which is very, very important. But it also targets that visceral fat. And then we also have the advantage. And so, someone who has a lot of that visceral fat, especially around the abdominal areas and the hip areas, that advantage supplement is actually helping to burn that fat quicker. So, we do use those just as tools for success. You definitely want to move daily. And when we say moving daily, you don't have to, be extreme. You don't have to go live in a gym constantly. But movement is actually it's medicine. It helps with the cortisol levels. It gets the endorphins up. There's so many things that happen when you are moving daily. You do not have to do extreme workouts. But if you aim for like 30 minutes of movement 5 days a week, or maybe you don't have 30 minutes all at one time, but maybe you can do a simple walk, 10 minutes after breakfast, 10 minutes after lunch, and 10 minutes after dinner. 10 plus 10 plus 10 in my book, you still exercise 30 minutes today. And it may be exactly where you need to start. Maybe you're unable to really get that exercise in. I know personally, I just had foot surgery 6 weeks ago, and I tried my hardest to work out yesterday. Well, I paid for it today. So, but I could do chair exercises. So never limit yourself to the mindset where, oh, I can't exercise, so I just won't do anything. There's always something that you can do, just getting started. So walking alone, that's going to improve your circulation. It's going to help support your heart function. It lowers your stress hormones. And Tara was just talking about those cortisol levels. The drops also help with those cortisol levels. That is one of the hormones that it helps to balance. Walking is also going to improve your blood sugar control. So that's very, very important. Strength training is also very powerful. As we age, we typically are going to lose muscle tone. If we are losing weight, we are losing muscle tone a lot. And so that's why it's very important for us to be able to get our protein in, but it's also very important for us to do strength training. The more muscle that we maintain, especially as we age, the better our body handles glucose and burns fat. So it's very important for you to do that. And the consistency is better than intensity. You need to be able to exercise on a daily basis. That's going to be so much better than you going to the gym one time and just really just ripping it out and then never going back. All that did was just stress your heart out. So be very, very careful with that. We don't want you to quit. I want you to find an exercise, and a lot of people will ask me, what's the best exercise? The best exercise out there is the one that you will do. So find the one that you enjoy and do it. Tara, I saw you and your nurses dancing in your office today. Y'all look like y'all were having so much fun. Sherry, I know you love to dance. Does this girl dance? Absolutely not. I would not get any exercise because these 2 feet don't move. So you've got to find the one that really works for you and makes you happy, because exercise should make you happy and give you that energy back. Your heart is not asking for perfection. It's just asking for consistency. And I think that's very important. One thing that I always want to stress is that we always want to focus on our lifestyle first. This is a habit, and it's very, very important. So when we talk about supplements, supplements are supporting the work that we're already doing. You cannot take a supplement out there and not put in the work of your lifestyle and expect magic results. And so that's what I really want us to focus on when we look at our supplements. We look at those as tools for success. So I'm going to introduce Candace. She is a team member of ours, and she's going to talk to us today about Venali, which is one of our heart health supplements.
So, Venali is one of my favorite supplements, and it is great for your heart, your eyes, your lungs, and your blood vessels. It helps to stop free radical damage before it actually starts. It's a super potent, broad spectrum antioxidant blend that protects the body, especially the skin, and from long-term effects of the unavoidable sources of oxidative stress that we come in contact a lot It has grape seed extract and grape skin extract that is sourced from Italy. The grape seed and grape skin extracts fight free radicals that supports your brain, supports your heart health, promotes skin health, and aids in your eye health as well. The vitamin C that we have, excuse me, that's in our Vanali is a layered vitamin C. So it's water soluble vitamin C, and that actually gets into your body better. It helps, our vitamin C helps with the skin elasticity, our collagen production, and it boosts skin radiance. It helps maintain healthy bones and teeth and supports our adrenal glands and boost our immunity, which is extremely important this time of year. It has acerola cherry that supports your immune system, fights free radicals, supports tissue development, aids in collagen production, and it provides nutritional support. It also has citrus bioflavonoids that are natural regulator of histamines and can help reduce the redness in your skin and other sensitivities that we have. I take it all year long and dose it extra near our seasonal allergy time. And I've not had to use an allergy medicine in 11 years. So, like I said, this is probably my favorite product. And hopefully it will be one of your favorite products as well. And next, we're going to have Amanda Junker, and she's going to be talking about Noni.
Yes. Hey, so what is noni? It's a juice blend made from three superfruits. It's noni, grape juice, and blueberries. And so what makes it special is what's inside those fruits. They contain three powerful compounds that are working together, iridoids, adaptogens, and antioxidants. So let's break that down because I know that sounds kind of technical. Iridoids are natural plant compounds that help your body defend itself and keep your cells healthy. So think of them like being your body's internal repair crew. They support your immune defenses, help protect cellular health, and work against harmful free radicals. Adaptogens are natural substances that your body can handle stress better. They're helping you bring things back into balance mentally and physically. And so we're talking about better mood, more mental focus, and greater resilience. And oxidants, a lot of us have heard of, they protect your cells from damage and support healthy aging overall. And so what really stood out to me when I started learning about noni was that in a 1 month clinical study, noni showed a 4.6 times greater increase in antioxidants in the blood compared to orange juice. It also showed a 31% decrease in free radicals, a 25% decrease in total cholesterol levels, and a 41% decrease in triglycerides. So, for a heart health conversation, those numbers are pretty significant. That was pretty exciting for me to hear about and to learn about. And noni isn't new. The noni fruit itself is sourced from small farms in French Polynesia. It's grown in the most fertile, pristine soils on Earth. And so that's actually what makes the iridoid content so potent. Noni has been around for over 25 years. Our noni is backed by more than 120 peer-reviewed articles and third-party tested as well. So it's really, really awesome. Let's see, it helps reduce oxidative stress as well. So whether your goal is supporting your heart, reducing inflammation, boosting your immune system, or maybe you just kind of want something that's going to help you get better, you feel better day to day, then the noni is going to help you work on that cellular level to get there. Next up is going to be Sherry with MOA. Take it away.
Hey guys, so I'm so excited to share this product with you. And part of the reason why is out of all the supplements that I take, this is one of my favorites. It's definitely in my top three. It's one of the products that I've been taking the longest. And that product is called MOA. And MOA stands for Mother of All. This product is one that you're going to want to add if you want to feel better, if you want to look better, if you want to have more energy, because it is made out of 36 superfoods. They get all these great ingredients with all these amazing, amazing benefits into this one little packet right here. Helps with immune support, helps with cellular protection, antioxidant defense, healthy aging support as well too. I personally love it because it has helped me so much with inflammation in my body. And so I brought one of these with me because I wanted to just share with you what it looked like. It's also in a single serving, so you just tear the top off here. It has a little bit of a spicy taste to it. It has blackcurrant in it, and it also has 6 medicinal mushrooms. A couple of the ones you're going to recognize is lion's mane, also shiitake. Okay, these are adaptogen mushroom blend, and it just has so many incredible benefits. So if you struggle with inflammation in your body, this is a product I would highly, highly recommend. Inflammation, if you didn't know, is the source of so much pain in our body. And so when you have swelling, when you have pain, this is a product that's going to help you out. It's got a little bit of a kick to it. I like it cold. And so you just grab it and drink it up. All right, next up
Can I
is
give
going
a
to
testimony on that one really quick?
yeah, definitely.
So MOA is definitely one of my, and I want one of those that you're drinking right now. But MOA is definitely one of my favorites. And I will say that, and I've taken it for years. But 6 weeks ago, when I had my bunionectomy, I started doubling up on that, which is something that I've always recommended for people who have, if they have had any type of surgery, get the MOA in. And if you ever have a flare up, take a double dose of it. So I started taking 2 MOA for the last 6 weeks. And after my surgery, I have screws and pins in my foot, and not one time did I even have to take Tylenol or anything. So I love my MOA. Just drink it cold or get
It's a
cold.
great testimony.
Great
All
testimony.
right, Leslie.
Hey there. I want to talk to you about another one of our fabulous products, and that is our Omega Q. Carrie, do we have that on there?
Yep, sorry.
There we go. Okay. Our Omega Q, it helps support your circulation and cardiovascular health. It includes CoQ10 for heart muscle energy production. It helps support your overall cardiovascular wellness. And it has your omega-3 fatty acids that help support healthy triglycerides. You know, as we start getting older, people say, you got to have that fish oil, you got to have that fish oil. Well, guess what? This Omega Q has that in it. It also has our Tahitian noni that Amanda shared about. So this is a great addition. It's something you take 1 tablet. It's actually a, so I brought mine too. You can't see it real well, but you take one of these twice a day. And so this will be your heart health add-on to that. We also want to talk to you about our 28-day challenge. There's a couple of us on here that have worked on a 28-day challenge for several years now, actually, and it's getting ready to start. So this is another addition that you can add on when you're taking the products that we have. This is a support system that we come alongside you, and for 28 days, 4 weeks, we help walk you through. It shows you the picture there that the drops, that's the only requirements we have, is you pay a $10 registration fee and that you have a box of drops. The registration fee does not pay the people that's doing the challenge. We are here to give back to you. So we give prizes away each week, and that will include our products, and some of which we probably talked about tonight. But we want to make sure and mention that tonight because our next 28-day challenge starts this Monday, February 23rd. So registration starts, it has already started and ends tomorrow night at midnight. So this is something that we want you to be a part of. If you'd like to, we'd love to come alongside you and help you in that journey. And so if you've come here and get back with the people that invited you so they can give you some information. I'm looking at the comments. I think we put in the link inside the comments. If not, we can try to throw that up for you. But we'd love for you to be a part of that. So Karen, I want to turn this over to you and you wrap it up for us.
All right. Thank you, ladies. So much good information has been shared tonight. If you learned something new, drop a 1 in the comments or just send up some hearts or emojis and let them know how much you appreciate what they shared. They shared some of my family's personal favorites. I'm sure that there are people here who want to listen to it again, or maybe you want to share it with friends or loved ones. The person who invited you will be happy to share the link with you. I think Coach Carrie is going to get it uploaded to YouTube and we'll have that link later. So just remember, as Tara said, it's never too late to start living well. I love that. So if you aren't already supporting your heart health, I know you want to start after tonight, right? So I'm just going to quickly go over your options on how you can get these amazing products. You can always just shop retail. You're just going to get back to the person who invited you or shared this video with you to get those products to add into your health regimen. But honestly, who doesn't want to save? I know I do. I've always been the girl that when I fall in love with something, I'm like, how can I get a better deal? So our better deal is membership pricing. Kind of like a Costco, Sam's, or BJ's, except ours only has a one-time $29.95 membership for lifetime access. This is going to give you 30% off all of our products. And what makes it special is that there's also optional business perks, but absolutely no pressure to sell. So most of the time, as we all know, when we're using something we love and seeing results, we naturally tell our friends anyway. I mean, even if it's a new coffee or, a new shirt and somebody comments on it, we're like, Target girl, So whether you just want to save 30% or you want to refer friends and get paid for and pay for your products by referring friends, or maybe you're like me and you want to build an income, the opportunity is here. And we just truly meet you where you're at. So you don't ever have to worry about being pressured because we're not going to pressure you. You just need to connect with the person who brought you here tonight and they'll help you get started in the way that fits your goals. And just remember that lifestyle builds the foundation, supplements support the structure, and business builds the freedom. So we appreciate you all for being here tonight. We do these focus topics once a month. So the next one is going to be on March 26th, and we're going to be talking about glowing from the inside out. As some of you probably know, we just released a new product. And we're just excited to see what kind of results we get and share that with you on March the 26th. So the person who invited you tonight will have that link when it comes out. So when you see them post the flyer or the graphic on Facebook, grab that link from them, and we look forward to you joining us then. So thank you for joining us tonight, and you all have a great night.
Good night, guys.
Bye,
Thanks for joining
everyone.
us.
Guys.